We are here with Dr. J. Cohen, an OBGYN in Fort Lauderdale. What type of food should a breastfeeding mother avoid, and what supplements should breastfeeding mothers take?
I think the most important thing for breastfeeding mother is the DHA. There's been studies show that the brain will markedly grows in the last trimester and in the first 1.5 years life, the brain for the baby. And at that point, the baby really needs a large amount of so-called fatty or DHA. So I think that if they're breastfeeding, it's important that mothers supplement themselves with prenatal vitamins or foods high in DHA, or if they're bottle feeding, that the Inframil, the Lipples, etc., the Similac with DHA, these are all very, whatever they have, very important for babies. So I think probably the most important thing for a breastfeeding mother is the fact that she supplements herself with DHA. You know, the other thing I think they should probably talk to their pediatricians if there's some foods that is transferred from the breast milk to baby that may lead to gas, or babies having problems with spitting up or a little bit of reflux. That should be discussed with the pediatrician.
Okay. If a mother gets an infection anywhere in her body, let's say such as a tooth infection, can that affect the breast milk?
Okay. Well, could it affect it? Even when women develop what we call mastitis with breastfeeding and we put them on antibiotics, we still encourage them to breastfeed. Depending on what the antibiotic is that they're treated with, the penicillins are usually very safe. The amount that's excreted in breast milk is usually small. Again, I always tell my patients to just check with their pediatricians. I do use Keflex. People do get urinary tract infections, colds. They may have to get prophylaxis, meaning for heart valve problems, called mitral valve. And a lot of the antibiotics that we use now are extremely safe. But some people, what they do is they pump and discard the milk. But on a lot of those medications, there should be no problem at all. But again, I have them talk to their pediatrician.
How long must a woman wait after giving birth before she can drink any alcohol?
I've had patients right after they deliver celebrate with champagne. The amount that's excreted in the milk at that time is extremely rare, and then even in the first couple of days, the amount excreted is minimal. I'm not telling you to go out and drink and get sloshed, but I have no problem if patients want to do a quarter of a glass of red wine. There is really no time limit. A lot of these mothers are extremely tired, they're restless, they're crying a lot, there's some depression, they're out of their niche. So if every once in a while they want to go ahead, have a quarter of a glass of red wine or white wine, I don't think that there's a problem with that for them.
Excellent. The last question goes back to pregnancy. What advice can you give to pregnant women who have cats as pets?
Well, cats occur because people worry about what they call toxoplasmosis. It's very unusual to see a house cat with toxoplasmosis. And toxoplasmosis what happens is that when there are little eggs that are dropped within the feces of the cat, so when the litter box is changed, the mother may actually inhale these eggs, which may lead to, especially in the first trimester, birth defects or problems with the fetus. So, number one, patients can already be tested. You can do what we call a toxotiter, which will let us know if the patient's ever been exposed. And that will give us a risk of an acute exposure or if they've been exposed before, and that's an easy lab test to be done. But I always tell my moms, please make sure that your significant other or who's ever in the household changes that litter. By cradling and holding the cat, the risk of exposure is extremely rare. It mostly comes from the feces of the cat where they're inhaled by the person. So I tell them not to change the litter. But again, it's extremely uncommon to see, and I've been doing this 21 years, a toxoplasmosis infection.
Thank you so much for your time, Dr. Cohen.
Thank you.